Fetyko, and it's my privilege to serve as CEO with the United Methodist Retirement Community in Porter Hills. I'd like to welcome our friends from Cedars of Dexter, and I appreciate the opportunity to spend a little time with you this afternoon to share our traditional annual state of the organization in a very non-traditional format. So I appreciate you all taking the time. Natalie is here with us today, so hopefully she can help facilitate looking at any questions that come up. As a reminder, there is a chat function, so please feel free to use that as I'm going through information. But we also plan to be able to spend a good 15 to 20 minutes at the end to open up for questions and answers. So I'll attempt over the next 40 minutes to give an overview of the entire organization and all that we've encountered over the last year, which may be a little bit of a tall order, but we're going to give it a go together anyway. So we always like to start at the beginning, which is the, oh, thank you, Natalie. I see that we'll use the Q&A for chat. So let me make sure I have that screen up as well. Thanks for the reminder, Natalie. We always like to start at the beginning, honoring and holding up our history. UMRC founded in 1906 by a few hardy individuals who saw a need to help support and provide housing and services to retired Methodist ministers and their wives. And on the west side at Porter Hills, founded in 1961 through some hardy individuals that were members of Westminster Presbyterian Church. That's a common thread throughout our history, identifying a need and working to help fill that need. Well, we've come a long way since that humble beginning, and now we're serving individuals in 23 counties across the state of Michigan. We provide services to 6,700 older adults annually through the incredible work of 1,300 team members from shore to shore. We do that in market rate and affordable independent living, assisted living and memory care, home health, hospice, skilled nursing, programs for all-inclusive care for the elderly, continuing care at home, and care coordination services. To give a sense of size and scale of our organization today, among nonprofit senior living providers, which there's over 1,000 nationwide, we are ranked currently 64th in terms of number of residential individuals that we serve, and 8th in terms of home and community-based service offerings in the country. Now, size alone is not the goal of our organization. It's to provide strong and supportive services to all those we serve. But what this does allow us for is to have ability to have a seat at the table. In particular, we've learned over the last 10 months to be able to advocate strongly on behalf of our residents and those we serve at the state level, in particular through MDHHS. So our focus, what I like to do is walk through kind of our organization focus over the last year, where we anticipate our focus for the coming year, and give some updates on all of our communities and service lines. So 2020 was really a very hard year for all of us. This is something that I don't know that any of us could have anticipated, and it's really been a difficult year to try to navigate all the changes in rules, regulations, all in that effort to help keep us all as safe as possible. Our focus became very quickly COVID-19 and all things COVID, and remains primarily focused on COVID-19. I'll get a little more into how that's impacted our organization in the coming slides, but we also do try to keep as part of our focus financial stewardship to make sure that we're making good decisions as we invest dollars very specifically in the care and services we provide. We always still want to focus on quality, and in particular during the time of COVID, a heavy emphasis on infection control and all the resulting processes and procedures that we need to take in place and have in place. We also want to maintain a strong engagement with our team members who are really on the front lines helping us get through this pandemic. We did continue some of the work related to our affiliation integration, and in fact, parts of it were accelerated as a result of the pandemic. Those system integrations to make sure we were communicating effectively, shared practices and procedures, as well as doing some of our work related to mission, vision, and values, and starting some of the high-level focus for our strategic plan. So COVID, we'll spend some time on COVID because that is the reality we've all had to live through for the last 10 months and continue to live through. So how has it impacted our organization statewide? North of 300 individuals, that's residents, participants, and team members, have tested positive out of about 8,000 we have statewide. We'd love that number to be zero, but as you've seen from how the pandemic has evolved over the year, we're actually running a little lower positivity rate. Actually, some areas very much lower positivity rate than the state averages. We've done 20,000, it's actually north of 25,000 COVID tests and counting. Why that's been so important for us is because it's the best way to quickly identify when there may be a case, in particular for individuals who may be asymptomatic, so we can quickly take the steps to hopefully minimize the spread of the virus. Over the course of the year, we've implemented over 200 new rules and orders that were promulgated by MDHHS, the governor, CDC, CMS, and local health departments. This has been one of the biggest challenges facing us, and I think our combined expertise in clinical leadership and quality leadership, frankly, have done a wonderful job of quickly assimilating, understanding, and applying these new rules as they came out. We're now well north of 100,000 daily screenings for residents and team members. Again, one of our first lines of defense to be able to quickly identify where there may be a risk of spread of the virus. And we've dedicated initially daily task forces, now more multiple times per week, or weekly task forces solely to our COVID response. This starts with our COVID operations team, our senior leadership team, teams dedicated to infection control, dining, supply chain, staffing, life enrichment, as well as other areas that we all needed to be able to focus and bring concerted effort to make sure we were addressing all the pressing issues as this pandemic has evolved over the last 10 months. At the start of this pandemic, we had to pivot quickly and aggressively pursue personal protective equipment and infection control supplies. At the outset of this, it felt like the wild, wild west in many regards. We all knew we had to get personal protective equipment, our face masks, our gloves, cleaning supplies, and they were in very short supply. We were ordering 10 times our normal volume at 5 to 10 times the normal cost per unit. That was just the environment we lived in. Unfortunately, we had that strong financial basis by which we could make those investments, despite the very challenging environment to secure and pay for those. Forced us to really rely on technology heavily and create message center, mass text groups, and frequent community communications in exactly the format you see today. I think we had a presentation by our head of IT, Paul Babcock, maybe a week or two ago. He shared an interesting statistic. I'm going to get the numbers off, but it'll give you a sense of the scale. As an organization, I think in December of 2019, we had 15 virtual meetings. I think in December of 2020, it was 2,500 or more virtual meetings. So we've certainly done our best to embrace technology and different ways to connect with each other. Certainly implemented dozens, if not more, new infection control procedures and continued to adapt those to the changing recommendations at the state and the federal level. Done our best to convert activities and wellness programs to remote and physically distanced platforms, as well as converting dining to delivery and hybrid formats, again, based on the changing orders of the state. Certainly implemented touchless screening technology. We've made our best effort to share daily COVID status on all of our websites. I am pleased to say, I think as of this morning, statewide, there is one resident with positive on the west side of the state and one team member among all of our communities and service lines. We certainly focused on significantly increased cleaning and frequency and intensity, implemented virtual visit for both family visits and medical visits. Some of our larger life plan communities added hospitality aides to help facilitate those virtual visits, and also invested heavily in hundreds of new devices to help facilitate those visits. In some of our communities, implemented personal shopping, especially at the outset of the pandemic, to address some of the concerns with people had with going out when there was a high risk of transmission. And also in our care areas, created dedicated COVID units, and as of today, passed every single infection control survey citation free. It was an interesting development during the pandemic that any skilled nursing facility, the state and federal government has asked that at least 3 infection surveys be completed to verify that all the appropriate procedures are being followed, and every single one of ours has passed those with flying colors. Well, as you can tell, we've also had some financial impacts of COVID-19. In general, senior living has experienced a decline in census, in particular in care areas. If you think about skilled nursing, a significant portion of our admissions to skilled nursing do come from hospitals, and at times there's been significant decline in elective procedures, which means we get fewer admissions. There's also been declines in assisted living census across the state and across the nation because of the uncertainty around the visitation restrictions in particular for skilled nursing and assisted living. And in fact, in the fourth quarter of 2020, it marked the lowest census in the nation's history for assisted living and skilled nursing. What does that mean? It means we've had decrease in revenue to the tune of about $5 million. What we've had to offset that is there were CARES Act dollars made available through the CARES Act, which was approved by Congress in the spring. And that went to CMS, which then got distributed out to skilled nursing facilities and other care areas. We've received just north of $2 million to help offset some of those decreases in revenue and increases of costs. Through our foundations, we've raised over $1 million specifically for COVID relief. That was to help with the increased cost of personal protective equipment, as well as to create some supports for our team members through appreciation pay and other increased costs that we incurred. On the expense side, we have seen additional costs. Particularly, we want to make sure that we take care of the individuals who are serving all of our residents. We did that primarily through an extra 2-week sick bank, specifically for COVID use for any team member who may need to go out as a result of having COVID or having to help support family members who become sick from COVID. We also provided early on in the pandemic some appreciation pay to help recognize that our caregivers in particular and those supporting our care areas were stepping forward to help be part of the solution for the pandemic. And then also when we've had to activate COVID unit to care for COVID positive residents in care areas to provide additional pay to recognize the risk that team members were taking on by volunteering for those units. We've also incurred significant dollar amounts in purchasing personal protective equipment and all the needed supplies to keep our communities safe and clean. Incurred well north of $1 million now in COVID testing for those 25,000 plus COVID tests we've conducted. This is another example where our state has stepped forward to help support senior living organizations. To date, the state is reimbursing us for every single one of those those tests completed through some of the dollars from the CARES Act that went to the state. What has been priceless is our ability to support our team members, especially through emergency aid, food banks, and meals while working, especially since many had spouses or other family members who lost jobs during the pandemic. While our main focus will remain on COVID-19, our response, supporting our communities, our team members, and our residents, we have also tried to be good financial stewards through this. We've been in historically low interest rates, so we took that opportunity to co-obligate and refinance $50 million worth of debt, which results in almost $5 million in future interest savings because of the lower interest rates we were able to secure. An example where we are stronger together between UMRC and Porter Hills and can see some real dollar savings in the long term. Also aligned our year ends, so fiscal year ends are now 6/30 for our main communities across the state, and really focused on consistent financial reporting so that our frontline teams and their frontline managers have all the information they need to be effective stewards of the resources for each of our communities. Also moved to have a common investment custodian across the state while we ensure that the donors' dollars given that we invest are reserved and used in the way exactly consistent with donor intent. We do have one point of contact who is helping us manage and direct our investments. We also virtually centralized our corporate office into a single legal entity called UMRC-PH. While most of us are working remotely because of the current MIOSHA orders, we do have that single central support service available for all of the communities and service lines that are part of our larger family. I'm going to spend a little time going through at a high level some of the key financial metrics, and I think you had spent time with Kim Hoppry, our CFO, in the recent past, but this is also just part of our overall intent to share this information so that you're fully aware of what our financial situation is and our status is. Days cash on hand is a key metric for senior living organizations. For us, the green bar on the right is that kind of metric. That's our debt-related covenant. And over the last few years, we've actually seen it increase relatively modestly, but a nice trend, so that we continue to be well in it, above that threshold. Debt service coverage ratio, which is really that measure of how much cash flow do we have to cover all of our debt obligations. Again, our debt obligation is at 1.2. We generally reside about 2.0. You can see in that 2020 number where some of the strains on our resources when we've had decreased revenue and increased expenses. Fortunately, we have a deep finance team that continually forecasts out the next 6 to 12 months so that we know we're remaining in a reasonable position for this. But this is one of the very real impacts of COVID, and one of the things we make sure we're managing through together. Another key metric is unrestricted cash and investments to long-term debt. This kind of tells us our access to debt, and our goal is to have this increasing over time, and we have seen some modest positive progress on this. Our recent refinancing is another way that we've been able to manage this and better leverage our organization. And the final ratio we kind of keep at is this core operating ratio. It's your profitability. Senior living is a little odd. We don't show it the more traditional way, but 100% means you're exactly break even on your operating cash flows. Generally, we're a little below that, which means we're slightly profitable. This year, you can see the strain that the increased revenue or decreased revenues and increased expense have put on us. But because of our overall financial reserves and the strong stewardship over the years, we're well positioned to be able to manage this. We do have a couple additional funding sources that we're waiting to hear on related to some of the CARES Act funding, which should help with this. But again, we want to be very conservative in estimating this and recognizing that we're really on the road to a recovery plan, but we have been able to rely on the accumulated strong financial foundation that we've established over the last 114 years. This is our current financial performance for the current fiscal year through November. So this is 5 months because our fiscal year started July 1st. We're off of budget about $800,000 for our core operations in our traditional residential communities. But we do look at this in its entirety. So what has been the main driver? Well, it's the decreased census that has been driven really by the uncertainty related to visitation restrictions in the care areas, assisted living and skilled nursing in particular. Our teams have done an outstanding job of managing their expenses. You can see cumulatively over $1 million below budget, and that's an area we continue to focus on. And in that $800,000 variance number, we do have almost $300,000 of a one-time paper-only cost related to our refinancing. Again, what that enables us to do is lock in over $4 million, close to $5 million of future interest earnings on a large portion of our debt. What has helped our organization in its entirety really navigate these uncertain times and some of the financial challenges is our diversity of service offerings. In the numbers below, you can see a total bottom line of $5 million. I do want to couch that a little bit. About $4 million of that is related to unrealized investment returns, and as we all know, that ebbs and flows throughout the year. But the total bottom line, if you take that out, is about $1 million positive, and it's driven largely now by our joint venture gains. And those are largely our PACE organizations, which have really been able, because they're home and community based, to weather the pandemic and really continue to serve people in their homes. Because of this overall balanced portfolio, we still made significant investment in almost all of our communities. And when I get into the community updates, I think you'll see where we've been doing it. In 2020, we invested $11 million of capital, and in 2021, $8.5 million, because we know we continue to need to invest in our communities, keep them up, because that is our duty to the residents who live in all of our communities and our responsibility. So as we think about larger initiatives, we also, as we coming together through our affiliation almost 2 years ago, we did want to create one single mission statement and vision statement for the organization. We actually did our survey of residents and board members and team members and leadership. Feels like ages ago, but it was actually back in late fall of 2019. Once COVID hit, we paused the work, but then we re-engaged, realizing we could accomplish a lot of this virtually. Ultimately, we were able to finalize that work and develop a shared mission in which we are welcoming all, partnering together and enriching lives. And we've chosen to embrace a bold vision in which it's a world in which we are all empowered to age well. We also have reaffirmed our guiding beliefs and their basis in our shared faith-based heritage. Our beliefs are integrity, wellness, inclusiveness, stewardship, excellence, and community. And by the way, we'll make sure that this presentation is made available to Natalie, because I imagine people may want to look at this after the fact, because I am going through it pretty quickly. We did start the work of setting a new 5-year strategic plan for the entire organization. I can tell you, we still have a lot of work to do. So far, we've identified what our strategic principles are, and there will be more work to come and more information to share with all of you. But our plans will be centered around our people. That's our residents, that's our participants, it's our patients, as well as our team members. Stewardship will always be part of our focus, as well as culture, quality, innovation, and growth. We've started to visualize this as a great way to remind us that our mission, vision, and values should guide and focus everything that we do. And ultimately, we'll continue to evolve this as we develop further, but it's a great way to make sure that we focus everything we do through the lens of our mission, our vision, and our guiding beliefs. So 2021, what is our initial focus going to be? Well, certainly top priority is going to be COVID-19 recovery and vaccine implementation. And you'll see me mentioning vaccine numerous times. That's our top priority and quality as well. And I'll pause there just to give a word or two about our progress on vaccine implementation. So I think almost all of our care areas have had their first dose through the incredible work of our operations leadership. I know Natalie sits on that team along with Nicole Mag, and through our leadership through Missy Latter in our quality department, we were able to get one of the first independent living clinics for vaccine on Monday of this week. And I know many of you availed yourself of that opportunity. What I can tell you as of today, for those clinics that we have run and for the residents that we've offered it to, we are running in the 90 to 95% vaccination rate. We have as an organization, because of the emergency use authorization, not mandated the vaccine, but we have highly encouraged it and really spent a lot of time trying to provide people fact-based information about the vaccine so they can make the decision. I'm thrilled to report such a high vaccination rate, and I am looking forward to the second round and continued engagement with our team members and residents across the state to drive that number hopefully even higher. Why we're so focused as an organization about that vaccine implementation? Because it offers the best hope for us to take those steps back towards some sense of normalcy. And by that, I mean ability to really gather together, to really focus on how we can connect in a meaningful way with family, friends, and loved ones. One of the reasons I'm so excited about that is it means I would actually be able to do these presentations at Cedars of Dexter and spend time with all of you. But that's why we've had such a high focus on this, and in talking with other senior living organizations, I think we're out ahead of the curve. We've definitely been able to gain access quicker for our independent living residents, and we're going to continue to advocate strongly on behalf of all of our residents across the state. In addition, from a quality perspective, certainly those infection control care outcomes and measures, always focused on team member engagement, recruitment, and retention. I think many of you are familiar with Eagle reaccreditation. That remains high on our priority list. We just need to make sure it fits in well with all of our other priorities. And certainly re-energizing and making sure we're laser focused on resident participation, satisfaction, and engagement. We've all had to pivot this year, and we've all had restrictions placed on us that I imagine we may not have wanted placed on us. And I think we'll be able to learn a lot of lessons. I think we've got a lot of things right through the process, and there's a lot of things we can still learn from as we went through this pandemic together. So hopefully we'll make sure we take many lessons learned and apply them to provide the best possible environment for all we serve. We're also hoping to finalize our strategic plan over the coming 6 to 12 months and remain focused on financial stewardship for the organization. From a philanthropic standpoint, I'd like to provide an update of both the UMRC and Porter Hills Foundations. As a reminder, their focus is on benevolent care, life enrichment and older adult services, team member support programs, and capital initiatives. Over the course of 2020, together we raised almost $5 million in support of our mission. And as I go through some of the community specific updates and highlights and service line updates, you'll see where we've been able to be successful in supporting our mission. One key area was in our Not All Heroes Wear Capes campaign to specifically support our COVID response. We raised north of $1 million specifically to help support our response and providing the safest possible environment. I can tell you in talking with other senior living organizations across the state and across the country, nobody can claim to have that kind of success. And it's one of the reasons we've been able to maintain, as of right now, close to 90 days supply of all needed and required personal protective equipment. For the foundations, our two foundations are working to align practices and collaborate further. They were able to launch a collaborative investment committee and conduct RFP for investment advisory services. So we have one investment advisor for our investment portfolios, while we still make sure that those dollars given by donors are only utilized in the way exactly how the donor intended. Combined our community magazine to share stories from across the state, supported the obligated group refinancing and supported those $4 million in interest savings. We're excited to launch emergency aid and scholarship programs on the west side and continue those and actually enhance those during the pandemic to support our team members as they were faced with many challenges. Also implemented planned giving across the state, did some of the behind the scenes work of aligning our databases and also making sure we connect with former chairs to make sure we continue to learn and seek counsel from the wonderful leaders we've had throughout the years. From a retirement community update, as we think about our retirement communities, we consider those CRC, Cedars, Porter Hills Village, Cook Valley Estates, and Meadowlark, along with our partnership over at Silver Maples of Chelsea. And within these communities, we are honored to be able to serve over 1,000 individuals on any given day through assisted living, memory care, independent living, and skilled nursing. Some key highlights, and when I go through these, this can in no way capture everything that has happened for the year, but it gives a sense for some of the things we've still been doing despite having COVID as our primary focus for the year. Excuse me. At CRC, we have actually completed our 5-year master plan. Despite some significant fits and starts in the last phase, we were able to finally bring it to conclusion over the last couple months, which means we now have that community almost completely repositioned over the last 5 years. We did move to in-house therapy at significant savings. We're able to get through 3 citation-free infection control surveys with compliments from our local health department as well as the surveyors. We're taking this opportunity where we're not able to fully utilize our dining space to do some updates to the dining room and add some other amenities so that we can be well prepared as that comes, being able to utilize that hopefully comes online in the near future. Move to a point of sales technology for dining, which allows us online ordering as well as more detail on nutritional information, and implemented a IL resident concierge service for a good portion of the year to help address some of those concerns that residents might have had in venturing out in the early days of the pandemic to get all the needed supplies and items that they might need, as well as implementing telehealth technology in our community. Cedars, you could probably list all of the items that have gone on the course of the year way better than I can, but we've maintained strong occupancy throughout the year. And I think that's a testament to Natalie and Jim and Mark and the whole team there in really trying to focus and engage with all of you in ways that we've never really had to think about. That, of course, was one of those critical connections this year, was that virtual communication and engagement model where we had to adapt and change when we couldn't really all meet together in the way that we wanted to, and really focus on some of the continued enhancements and investments in the existing community through the clubhouse, as well as the pool and spa. And we're looking, because we know that the current orders around restrictions for dining and group activity and the like will be potentially expiring the end of the week. And I know we'll probably be getting some communication out about that in the next couple of days as the state is finalizing what the next phase might look like for Michigan. Over at Silver Maples of Chelsea, really focused on census and being good financial steward. They are in the midst of building 15 additional villas with completion this summer, and that seems to be going quite well. And they're also, like many of our other communities, focused on some of those common area and dining space updates to make sure we continue to invest in ourselves. They are also the recipient again of a Hollerin' Choice Award, which is a resident engagement and satisfaction, as well as team member engagement award, which means they're really operating in the top 10% of the country. So that's a wonderful example and an area we can certainly learn from and hopefully be able to apply to many of our other communities. Over on the west side at Porter Hills Village, finished a garden roof project. Sounds small, but what it is, it's really shoring up. It was a close to $2 million project for an underground parking structure, making sure that it was structurally sound for the next 20 years. It had been there 20 years, and creating some wonderful amenity space on the top that can be used by residents, hopefully as we get to the spring here. Like we did on the east, we moved in the west in-house therapy, reopened our garden cafe, and are developing a refresh plan for that. Like all areas, we've embraced technology using a technology called Boxcast to offer virtual updates. I believe, hopefully many of you have seen the concert series we have going on. That's the technology we're using to kind of spread that weekly concert experience out to all of our residents. We're able to bolster census in an area we've been struggling in the past that has gone down a little bit since then, but it's allowed us to really focus on the value proposition for our residents in that part of the community. And again, I say 5, it's actually become 6. We had a survey a couple weeks ago, remain citation free for any infection control surveys for our care areas. Over at Cook Valley Estates, again, moved to self-operations for dining. That was an initiative we did a couple years ago on the east side. We're following suit on the west side, and moved to a more restaurant-style dining with enhanced dining options for that community. Again, embrace technology through Care Merge and fireside chats. And over on the west side, we're starting our master planning, similar to the planning we've finalized over the last 5 years for Chelsea. We're engaging in that for Cook Valley Estates and Porter Hills Village. And all the while making investment in deferred maintenance. In the case of Cook Valley, that's in some of our townhomes. They're 20 years old in some cases. So addressing deck replacements, siding, sliding doors, sidewalks, and the like. Those things that we need to by living in Michigan and they're exposed to the elements, making sure we're investing in and replacing and keeping up those aspects of all of our communities. And for them, it was a theater room renovation that has been a couple of years in the making that we're looking forward to being able to utilize here, hopefully in the not so distant future. Over at Meadowlark, which is on the west side, again, kitchen renovations, communication, Wi-Fi to make sure we have that good communication. And Meadowlark is a good example of really trying to invest in our team members, and in particular in the care areas, those who provide direct care or supports to those areas, really focusing on creating career opportunities for our care staff by creating advancement opportunities and really focusing on the value that our caregivers bring each and every day. For affordable housing, we continue to be proud to have 9 affordable housing communities serving 450 or so individuals each and every day. On the east side, down in Detroit, the Rivertown Assisted Living as well as Rivertown HUD. Really what's been the focus down there is the care of those residents down there. We've been able to avail ourselves of some grants that help us address some of the personal needs of the low-income individuals who live there, as well as some investments in technology for connectivity for those individuals. We are thrilled to share that Detroit, as many of us know, was extremely hard hit starting in March and April. We did have 1 resident turn positive who ultimately did return to our community, and since then, no COVID cases in downtown Detroit. Over at the Pines, it's a similar theme, investing in the community, upgrading some of the safety measures. We did a refinancing to take advantage of the historically low interest rates. What that means is we were able to set aside some additional capital dollars so that over the coming years, as that building approaches 20 years old, we can invest in kitchen and bath updates as well, and renovations, as well as HVAC system replacements that are going to need to be prioritized in the coming years. On the west side are 6 HUD communities, again, also focused on just typical building updates, asphalt projects, but with those communities, because they're HUD financed, really laser focused on complying with all the rules and regulations that come along with HUD financing. And you can see a visual of the 6 HUD communities. For home and community-based services, I'll walk through our 4 PACE organizations and hit some of the themes. Huron Valley PACE over in Ypsilanti, Michigan, serving the counties you see there. We are serving 200 individuals today as participants. We did expand 2 years ago now and do have capability to serve even more. From an innovation perspective, Huron Valley PACE was recognized by NPA, which is the National PACE Association, and asked to present to other PACE organizations on how they've been able to keep strong participant satisfaction and some of the innovative responses they've had to engage with their participants through the pandemic. Huron Valley PACE has been a national leader in the PACE for Black Lives campaign in support of the incredible ethnic diversity of the individuals we serve through PACE. For PACEs, in recognition of the challenges of the isolation that the pandemic has brought and the limited ability for us to bring our participants into PACE centers, we were able to focus on behavioral health programs, and they were able to gain a $200,000 grant, which allowed us to partner with U of M to really invigorate those behavioral health programs. Certainly, PACE is a home and community-based model. As a reminder, you have to be nursing home eligible to be a participant, which means if not for the PACE program, you have a high likelihood of needing to move into a nursing home. So this is home-based care, but it was center-based. Our center was the hub of our activity, and in all of our PACEs had to translate to a true telehealth home-based care model for our participants. Huron Valley PACE was one of 20 PACE organizations in the country selected for PACE 2.0, which they were selected based on their ability to help grow their participation. And again, this will be an opportunity to hopefully facilitate continued growth, which means we can help more people stay out of nursing homes and enjoy their lives in their homes exactly where they want to be. At Senior Community Care, which is based at Lansing, the focus has been very similar. Really servicing those participants we serve today and converting our care to true home-based. One of the ways they've done it in Lansing is to really break up into regional care teams so that our teams, as they go out in the communities, can be focused in very defined geographic areas as the best way to support those residents. They've also had leadership changeover and are acclimating the teams to those changes in the executive director, center director, quality nurse, and clinical services director. Over at Tomei PACE in Jackson, we're proud that we are now serving 200 participants, and actually Tomei PACE, I believe, is the only PACE in Michigan to actually hit their enrollment cap. The reason we can serve 200 individuals today is because they did complete a significant addition to the building this year. And how did we complete that building? Well, through our foundations. Foundations working with the Weinberg and Tomei Foundations raised $1 million in support of that addition. Again, converted to a true home-based and telehealth related care model. and again, focused on telepsychiatry services in case of Tome Pace in partnership with MSU to address those very real mental health impacts of the isolation that we've all felt as a result of this pandemic. Another key innovation here is Tome Pace and Huron Valley Pace partnered together and hired a full-time pharmacist that the two can share, which has proven very valuable to help manage all of the medication needs of our participants, really focused on improving quality of life, lowering the number of medications needed, and really reduce those drug interactions. And as a great example of what is at the heart of PACE and why we've embraced it so fully, is that PACE is meant to keep people in their homes, even though they meet all the eligibility requirements to be in a nursing home. Tome Pace has successfully kept 99% of their participants from being permanently placed in skilled nursing, which is well better than the national average. And our final PACE is over on the west side of the state in Life Circles, which has care centers or day centers in Muskegon and Holland. Life Circles was also selected for PACE 2.0. So we have 2 out of the 20 organizations in the country who are within our larger family. Again, focused on technology enhancements. For Life Circles, it's focusing on making sure we have high quality, affordable residential options for those participants who do need assisted living options. And again, focusing on some of the mental health and behavioral health challenges. They were able to secure a $100,000 grant to bring a positive care approach, which many of you may have heard about. A couple of years ago, we received a similar grant on the east side of the state and did significant internal and external community training around how to effectively care for those who may be experiencing memory loss. Rounding out the last few home and community-based services that we're part of is our home care service, which is a certified Medicare home health agency. It's been centered in Grand Rapids, maintains a 5-star rating. It's really been focused on expanding its network of preferred providers. Through orthopedic surgeons, we are looking to move this service to offer it on the east side of the state as well for any residents in our east side communities that may need it as well. We're in the midst of trying to finalize the plans to bring it to the east and are just finalizing approvals at the state and federal levels to open another office on the east side to extend that service. Other than that, they've been focused on filling any need they can. And our home health in particular, because of the large number over the last few months in particular of hospitalized COVID-19 patients on the west side of the state, a large portion of our business has been supporting in their homes COVID positive individuals who are discharged from the hospital. So they've truly been at the heart of our mission in serving people who are in the highest need. We continue to be a proud partner in Emmanuel Hospice, which is a hospice centered on the Grand Rapids area and servicing the greater Grand Rapids area. Because we are in the older adult services industry, at any given time, there are individuals within our families who are utilizing hospice, and it's wonderful to be part of an organization that we know can provide a high quality service in what is the most difficult time of individuals' lives. That partnership has experienced significant growth over the last 2 to 3 years, is recognized as a best and brightest place to work for, and really, again, has been focused over the last 10 months on technology to ensure clients are connected with loved ones and going out of their way to fulfill those patient wished requests, which are also critical at that stage in a person's life. Our last partnership I'm going to speak about is Tandem 365, which is a managed care and health navigation service. One more way we can help support older adults in their effort to remain in their homes. This is actually through contracting with Priority Health, an insurance company, as well as BCN for those high-risk individuals to help manage their care and help them navigate the systems so that they can safely remain in their homes. It's a unique partnership in that we also partner with an ambulance company, and we use community paramedic programs on the west side to really be those eyes and ears to quickly be able to get to members so that they can get the care in their home and avoid unnecessary emergency room visits. So we're serving almost 1,100 individuals today, and it continues to be warmly received by our partners at the insurance companies of Priority Health and BCN. Our final home and community-based service is Porter Hills Avenues. This is centered in Grand Rapids, and it is what's called a CCRC without walls. Actually, only one of 30 in the country. It's similar to an entrance fee model, which you're very familiar with, which is an entrance fee and monthly service fee, but in this case, it's for the individual to remain in their home. And what it brings with it is care coordination services, wellness and activity program, defined home care and other health care services that may be needed, with that primary goal of keeping members independent in their homes. Thrilled to report we've remained COVID-free for our 50 or so members of that program. And certainly this also included a significant implementation of technologies for engagement and connectivity. And we are very proud to be able to share that no placements in long-term care, which means we're achieving our goal of helping individuals stay exactly where they want to live their lives in their homes. So with that, I have covered a large body of information to hopefully give a good sense of where we've been as an organization over the year, where we've been focused, and where our focus is going, starting off 2021, which is really, first and foremost, on making sure we recover from COVID and come out of COVID and this pandemic hopefully stronger than we were before. So with that, I think I'm looking at the right chat boxes. Natalie was able to confirm the pool project is wrapping up, which hopefully will be good news if we're able to take some lifting of restrictions step forward at the state level. I know the governor had a press conference today and we're still kind of validating how that impacts some of the orders that expire on Friday. So I'm happy to take questions. I will just ask Natalie, if you see some come through and I miss them, please let me know. I'm doing my best to be acclimated to all the technology, but sometimes I miss some of the places that those questions get asked. So if there's any questions, and hopefully there is a way we can take them off mute as well so that we can spend a few minutes answering questions. I'm just clicking to see if there's any out there. If there are none, I know the key reason is because Natalie has been spending a lot of time communicating with all of you. So if I don't see any more questions, hopefully, we'll get to see each other. I think our best chance at a group event is the second dose of the vaccine. And hopefully what that'll mean is we can continue to see downward trends within our communities, but in our broader communities, because that's what's going to trigger some of the reduction according to the state plan and some of those visitation and other restrictions. I can tell you we are on a positive trend. Cases have come down in the state of Michigan in particular over the last 2 to 3 weeks, which I think is fairly impressive given some of the experience we're seeing in other states. So, Michiganders, we take our own health seriously, and I think that commitment to community and commitment to protecting each other is one of the reasons we're taking that step. And David, I appreciate that comment. 95% vaccination rate is better than we could have hoped for, and frankly, better than many other communities in what I'm hearing. So kudos to all of you for choosing to be part of helping us end this pandemic, because that is a personal choice on your regards. So appreciate that. And one other comment, yes, the slides, we'll make sure we get those out to Natalie. These are meant to be for you. This is information you should be able to look at and be able to think about and ask questions if they don't come to mind today. So with that, let me just check one other spot. I don't see any other questions. Well, hopefully if we, knock on wood, can continue along this path, I'm hoping I would love to be able to do a mid-year connection, actually in person. I don't care if I have to wear a mask. I don't care if we have to be 6 feet apart. I just want to be able to do it in the same room with all of you, so we could spend a little time getting back to the business of living our lives and connecting with each other. So again, I appreciate you taking a little time out of your day. And I know that Natalie does a great job as questions come up. We can certainly facilitate future time together to address any concerns as they may come up. But from what I heard, it was a great day Monday when we, if I remember the numbers, almost 350 independent living residents between Cedars, CRC, and Pines were able to get their first dose. So kudos to you. Thank you for being leaders in helping us hopefully take the next step together back to, well, probably a new normal. I don't know if we'll ever be completely back, but thank you all. And thank you for enduring probably, at least for me, the most challenging year of my life. You've been incredibly kind and supportive of each other and of us, despite basically most of our choices all be taking away from us. So thank you. And until we see each other, please stay safe and be well.